Pancreatic cancer is one of the most lethal human cancers, accounting for more than 400,000 deaths each year. Despite efforts in the past 2 decades, available treatment options have had little impact on the course of this aggressive neoplasm, with only 9% of diagnosed patients surviving 5 years after diagnosis. Inflammation assumes a substantial role in mediating tumor growth and progression in pancreatic cancer. The interaction among varied constituents in the tumor microenvironment are mediated by cytokines, which provide cellular signals that regulate communication networks. Cytokines are secreted proteins that have a specific impact on the interaction and communication occurring among cells. Interleukin-6 is involved in tumor cell proliferation and differentiation, while interleukin-8 promotes tumor cell invasion and metastasis. Finally, VEGF facilitates angiogenesis. Cytokines can also be classified into groups based on their biologic function. T helper 1 cytokines facilitate an increased cell-mediated immune response, while T helper 2 cytokines elicit a humoral immune response. Meanwhile, pro-inflammatory cytokines stimulate inflammation, and anti-inflammatory cytokines regulate and control the immune response, resulting in immunosuppression. This meta-analysis explored the role of cytokines as a prognostic biomarker of overall survival in pancreatic cancer. Relevant studies were identified via electronic search of PubMed, Embase, Web of Science, Google Scholar, and Cochrane Library databases up to April 30, 2020. The following were our inclusion and exclusion criteria. Data was extracted based on a prepared form. Using Review Manager, pooled hazard ratios and 95% confidence intervals were calculated. The following diagram illustrates the study selection process. A total of 172 full-text articles were assessed for eligibility, and 147 articles were excluded since they did not conform to the inclusion and exclusion criteria. Thus, a total of 25 studies were included in the meta-analysis. A total of 3,213 patients were included, with a median of 62 patients per study. Cytokine expression was usually determined from serum samples, with ELISA being the most common method used to quantify cytokines. The most common cytokine assessed was VEGF. Most of the studies used the median value as a cutoff for high versus low cytokine expression. Study quality of included studies range from 4 to 9, with a median of 6 stars based on the Newcastle-Ottawa scale. Using a cutoff value of 7, 6 out of 25 articles were of high quality. 7 studies investigated the association between interleukin-6 and overall survival. A total of 1,871 patients were included in the pooled analysis. High levels of IL-6 correlated with worse overall survival. Heterogeneity of studies was considerable, but subgroup analysis showed stability of the association between high levels of IL-6 and worse overall survival. The relationship between IL-8 and overall survival was elucidated from 5 studies, comprising 384 patients. High levels of IL-8 were associated with inferior overall survival. Subgroup analysis demonstrated stability of the association between high levels of IL-8 and inferior OS. The association between VEGF and OS was investigated in 8 reports, comprising 638 patients. VEGF levels were not significantly related with OS. Looking at the functional groups of cytokines, 5 studies comprising 717 patients investigated the relationship between T helper 1 cytokines and overall survival. High levels of T helper 1 cytokines were significantly associated with worse overall survival. The relationship between T helper 2 cytokines and overall survival was considered in 9 reports, comprising 1,954 patients. High levels of T helper 2 cytokines were significantly correlated with inferior overall survival. Heterogeneity of studies was considerable, but subgroup analysis showed stability of the relationship between high levels of T helper 2 cytokines and inferior overall survival. 9 studies consisting of 1,621 patients examined the association between pro-inflammatory cytokines and overall survival. High levels of pro-inflammatory cytokines correspond with worse overall survival. Finally, anti-inflammatory cytokines were not significantly associated with overall survival. This is the first study to investigate the role of individual cytokines and functional classes of cytokines in prognosticating overall survival of pancreatic cancer. The results demonstrated that high levels of IL-6 and IL-8 were associated with worse overall survival, with the strength of association being most apparent in the IL-6 subgroup. Inferior overall survival was also linked with high levels of Th1, Th2, and pro-inflammatory cytokines, underscoring the importance of inflammation in the pathogenesis of pancreatic cancer. Some limitations must be acknowledged. First, there was no standardized method for assessing cytokines. This may contribute to the heterogeneity seen in the pooled data analysis. Moving forward, future prospective studies should utilize a standardized methodology to assess cytokines. Secondly, majority of the articles were retrospective cohort studies, which are subject to the risk for selection bias. Prospective studies are needed to confirm study findings. Finally, the quality of available studies were lacking. The process of participant follow-up must be clearly stated in future studies. Cytokines show promise as a prognostic biomarker in pancreatic cancer. A better understanding of the tumor microenvironment can unearth novel therapeutic targets that improve survival in this dreaded disease.